Why is hypertension an important topic? Well, first of all, hypertension is the number one risk factor for death in the entire world. And we're going to explain why that is so. But basically, pressure put on blood vessels damages the inside lining called the endothelium. So we cannot get blood out where it needs to go to deliver oxygen and nutrients, and we can't move waste out of the body very well. It's like you have a big interstate of blood vessels and you put pressure on that interstate. We can't move goods in, we can't move goods out. And if this goes on long enough, it causes damage wherever a blood vessel will go. So that's a number one risk factor for death in the entire world. So it's only important that we learn about it and control it. 18% of all deaths in the world, about 1 in 5, can be attributed to hypertension. And we're going to talk about what hypertension, and it affects about 22% of the world's population. Well, why do I say it's a hidden killer? Well, a lot of people walk around without it and they don't even know. I saw a gentleman that was 45 in the hospital. He came in last week with severe heart failure. He couldn't breathe. So we put him up on a ventilator. And we had to breathe for him. We did some testing, and we found out that his heart was entirely worn out. Well, he didn't know that, but at age 18, he had developed high blood pressure. And can you imagine pushing out with weights year in and year out? You're pushing against all that pressure. At first, the muscle gets really, really big. And then after you lift weights long enough without any rest, guess what happens? It gets weak. And when it gets weak, it malfunctions. And when it malfunctions, guess what happens? All sorts of bad things. So this was a leading cause of death in this gentleman because he had this for all of those years and did not even realize he had hypertension. So that's why this topic is so important. It's a hidden killer. Not only because it causes death, it damages the endothelium, but it's hidden because people don't even realize they have this. So in exploring this topic, as we understand the damage, the next thing we want to talk about is the many organ systems that it damages. So if we think about it, wherever blood goes, high blood pressure damages the endothelium. And if it goes on long enough, the organ is either damaged by either blood not getting in or getting out. So if we think about the organs that's damaged, hypertension contributes to strokes. We might not even know it, but it puts pressure on the bloods. It can trigger aneurysms. It can trigger blood clots. As we work our way down, it can damage the back of our eyes. That's called the retina. It can damage the retina because retina has blood vessels too. I see it in the heart all the time. It can make the heart weak because it has to pump against pressure, and all of that pressure going through the blood vessels can make the endothelium, the lining, more likely to pick up fat, which can cause atherosclerotic diseases. Well, outside of the aorta, we have large blood vessels. The aorta is a blood vessel. All the blood vessels that go to the arms and to the legs, that can be damaged as well. Sometimes all that pressure, if you have a weak spot in a blood vessel, it can make it enlarged. We call that an aneurysm. The most dangerous aneurysms are in the brain. We call that cerebral aneurysms. If they're above the aortic arch area, we call that ascending thoracic aortic aneurysms. If it's more downstream, we call that abdominal aortic aneurysms. We can have aneurysms in the arteries in the legs. That's called iliac aneurysms. We can have aneurysms or weak spots in the back of our legs. We call that popliteal aneurysms. So high blood pressure affects the blood vessels wherever it goes. High blood pressure can affect the kidneys because it affects the blood supply to the kidneys. It affects the blood supply to the lungs. So anytime you have a high pressure system, the organ has a hard time handling it. And if enough damage is done, sooner or later, that organ causes a malfunction. Modern medicine is great at fixing emergencies. If we can catch an aneurysm before it bursts, we can put a stent in it. If we can catch a heart attack, sometimes we can help that. But sometimes we're in damage control when blood pressure has gone on years and years. That's why it's called the hidden killer. That's why people don't even know they have it. 1 in 5 people don't even know they have high blood pressure. So now, hopefully, I've convinced you a little bit that high blood pressure is indeed a problem. So how do you know if you have high blood pressure? Well, a lot of people walk around with high blood pressure and they don't even know they have it. They don't even know they have it. They walk around, they feel fine until, guess what? Something bad happens. By the time something bad happens, it's entirely too late. We don't want that to happen to you. So I'm asking you right now, as you listen to me, do you have high blood pressure? Yes or no? Or do you even know if you have high blood pressure? Well, the way we measure blood pressure is with the device that goes around the arm. Many of you have seen that. It's called a sphygmomanometer. A sphygmomanometer, that's how we measure blood pressure. And it goes up and it can actually measure the blood pressure in a certain vessel. And if we arbitrarily have given numbers to what we consider high blood pressure. And normally, when a blood pressure, the top number, that's how much pressure is generated to the whole heart when they pump, that's called the systolic blood pressure. When that blood pressure is usually, it starts going above 130, 140, 150, that's the pressure inside the arteries, that's way too high. And people can have it and they don't even know it. Now, the pressure when the heart relaxes, that's called the diastolic pressure, the relaxing pressure. And usually we like to keep that number at least below 90. So as a general rule, we like to keep the number of blood pressure at least below 140, the top number, systolic, the bottom number at least below 90. However, in certain situations, we want to keep it even lower than that. Let's say a person has an aneurysm, or has had a stroke, or has a weak heart, or has an organ that's already been damaged by blood pressure. We don't want to keep pushing all that blood pressure in there. We want to make it even lower than that. So in those people, a blood pressure of 100, 110, 120 on the systolic might be better for that person long term. So when we think about blood pressure, the first is seeing if you have it. The monitors that you wear, the ones around the wrist, usually run a little bit high. And you want to take your blood pressure after you're sitting down, no stimulants on board, that includes caffeine, medications, driving to work. You want to sit down for about 10 minutes, breathe deeply and relax. Put the monitor around your arm, and that really gives you a true blood pressure. I can't tell you how many times in the office we measure a blood pressure and the person's nervous and the blood pressure is really high. We panic. And when we panic, guess what happens? We panic, we think that's really high, we put them on a blood pressure medication. So we estimate that about 75 million people in the United States experience high blood pressure, but it's all around the world. And after the age of 60, it's been estimated that 65% of all of us will have high blood pressure. And yet, 1/2 of the cases, as we've talked about, goes underdiagnosed. We also have noticed that hypertension has been associated with the spike protein. Both the spike protein that we get from COVID-19, the virus, as well as the spike protein that's been received by the vaccination. And there's now these articles that show that people that have had the COVID-19 vaccination are having increased risk of hypertension. As much as 3.2% of people that have been vaccinated are coming down with hypertension. Those are the ones that we know it. So we now have another cause of hypertension, but as we talked about earlier. We do not want to have heart attacks, which hypertension can trigger. We don't want to have heart failure. We don't want to have the aneurysms I talked about. We don't want to have the strokes or the kidney failure or any organ or the vision loss. Also, we don't want to have problems with our arms and legs. This is not a good thing to have. This is not good. So as we go on, we talked about hypertension, and it's so controversial. Remember, it's a number. The American Heart Association uses the perfect number as 120 over 80, but there's others that say 140 over 90, but for sure when it starts to get above 160 over 100, it's way too high. So I think it's good for us to spend a few minutes today about understanding how diseases come about and realizing that hypertension is just a name that people have given to a condition. In fact, years ago, they used to call this hard pulse disease. It wasn't called hypertension. It causes hard pulse disease. And here is a treatment for hard pulse disease. The doctor there is actually taking blood out of a person's arm to lower the blood pressure. And that works today. If someone's bleeding to death, their blood pressure goes down because to take blood out of the system. This guy is not too interested in the doctor taking it out. So they found other ways of getting blood out of a body. And another way they used to treat hard pulse disease, which was hypertension as we call it today, was putting leeches all over bodies. So people would walk around that had hard pulse. They couldn't measure it back then, but they could feel the bounding pulse. They knew something was wrong. They put leeches on him. They also found out if they could cut back anger, certain foods that they ate, they could also lower blood pressure. They also found out that increased consumption of spinach, we still know that greens today will lower blood pressure, and they found out that vinegar, that's what they used it years ago. Well, that's what they called it years ago. They called it hard pulse disease. It wasn't well described, but they knew it was a problem. It wasn't near the problem back then as it is today. So all along, about 1578, 1657, they lived this genius called William Harvey. And that wasn't that many years ago. And here's a picture of old Bill here. He figured out that, guess what? We had a blood system that carried blood throughout the body, that brought nourishment, including oxygen, to the cells, that returned waste. He first described the circulatory system. So for all of the history of the earth, we did not even know about this. And guess what? That wasn't that many years ago. How many years ago is that? 400 or 500 years ago that we've already discovered where the circulatory system was coming from. So then all of a sudden, if you look at the history, in 1733, Stephen Hale, that probably wasn't his real hair, by the way, that was probably a wig, but he was the first one that could record a blood pressure. We didn't even record blood pressures till 1733. That's when we found out that there was pressure in the system. Both pressures in the arteries, that was a high blood pressure that take blood away from the heart and that brought us back to the heart. We called that low blood pressure. So about 1844, Richard Bright found out that high blood pressure and kidney disease go together, and he named the disease of the kidneys called Bright's disease that we still have today, but that was a few hundred years later. So nothing happened for about a century in blood pressure. In 1896, this good-looking guy, Scipio Rivarocci, invented the sphygmomanometer. A way to think about that is just a fancy device to measure blood pressure. That's all that is. A sphygmomanometer, a fancy device to measure blood pressure. Then in 1905, this fellow on the far right, Nikolai Kordakoff, he improved the blood pressure technique and also figured out these sounds that when the cuff went up, we heard these sounds. He called these Kordakoff sounds. We call that today. That's how we actually measured blood pressure. And that was in 1905. That was 115, 20 years ago. So it wasn't that long ago. So for thousands of years, we didn't even have a name of this condition of increased pressure in the bloodstream. So I think the history is very interesting. But all throughout the history of medicine, regardless of what disease we have, we've had many different diseases, from cancer to diabetes to infections to hypertension, now to the COVID-19 pandemic. We've had many different diseases, but there's always been controversy. Well, there was controversy regarding the sphygmomanometer, and this is in the British Medical Journal about the time that this was being discussed, whether we should measure this thing called blood pressure. It says, we pauperize our senses and weaken our clinical acuity when we use a device to figure out something that we used to figure out by touch and physical exam. Well, just think about how that would be today with the MRIs, the CAT scans, the fancy ultrasounds they have. We have all sorts of ways that the British Medical Journal, if they thought a sphygmomanometer pauperized our senses and weakened clinical acuity, they would say that by 10 times today. So there's always been controversy in every disease. So these guys, over 100 years, didn't feel that controversy. But guess what? In 1906, things started to change. Insurance companies saw the importance, including the insurance company called Northwestern Mutual. They figured out that people that had hard pulse disease, hypertension, were dying. They were dying. So insurance companies, they were interested in this, because if they could find out people that would die, they could save money by changing the policies of people that actually had hypertension. So maybe these Korsakoff sounds had something to do, and that was found about 1906. But in 1911, Malman and Frank finally named this disease, and they called it essential hypertension. Now, I've covered a lot in a short period of time. So I just want everyone out there to take a deep breath. If you need to grab a glass of water, now's a good time. If you need to go to the bathroom, it's not a bad time. And I want to also remind you that we're going to be doing a few questions and answers at the end of this webinar, that you can type in a question. I'll do my best to answer as many as I can. And also, if you need to get a hold of me, my personal email is heartwise, one word, J as in Marcum, @yahoo.com. And I am a speaker director of a ministry called Heartwise Ministries. And if you want to learn about that, you can go to our website, heartwiseministries.org. And if you want to learn about all of the interesting things that's been done at the Wildwood Health Institute, you can get a hold of Wildwood Health Institute. Just type it into your computer screen. They'll give you a lot of information. In fact, just a few weeks ago, I was able to participate in a week where we had people from all over the country come with different medical conditions, and we help treat those naturally when possible. But more importantly, we introduce them to the source of healing, and the source of healing is Christ. Christ is the key to health. It's nice to know about hypertension. It's nice to know about all of these diseases and way we can do better. But when we know Christ, we can have hope that leads to eternal healing. So hopefully that gives everyone a little bit of break time as we continue our historical and talk about hypertension. So as we getting back to hypertension, we're now up to about 1911. We have described what hypertension is. There's some financial concerns, and all of a sudden, since we're measuring it, we're finding out that more and more people have this disease that was originally called hard pulse disease, but it's now called hypertension. So now that we have a disease, we have to do something about it. We can't just let it happen. So we named a disease. So here we are. This is one of the most famous physicians of all time in 1912 as we start dealing with hypertension. This is Sir William Osler. And he says, in looking at the people that we're finding out that have hypertension, he says, in this group of cases, the ones with hypertension, it's well to recognize that the extra pressure that are in these blood vessels is a necessity as purely a mechanical affair. We need this pressure to stay alive. And he says, get it out of your heads if possible that this high blood pressure is the primary feature, and particularly the feature to treat. So he thought we had high blood pressure, but he thought maybe it wasn't that important. Maybe something else was driving it. And this started the controversy that we see in every disease today. Physicians have always argued and debated over all of this. What should we treat? How should we treat it? Whether it's a big problem, whether it's a little problem. And Sir William Osler jumped on this today in 1912. So they said, Les, we need to do something about it. And so the early treatments, now some of those treatments that were done long ago still work today, but it just wasn't a smart thing to do, like letting all the blood out of your body. That wasn't a good idea. Putting leeches on a body to lower the blood pressure, that wasn't a great idea. Spinach wasn't a bad idea. We can still use that today. Cutting back anger wasn't a bad idea because that cut down adrenaline. That was a good idea. Early treatments, they figured out sodium early on was a bad idea. Sodium tended to drive blood pressure up. And as we became more and more industrialized, people started eating more sodium. Remember, we didn't put our food in preservatives for many years. But all of a sudden, we started freezing our food. We put lots of sodium on foods. We started eating more fast food. The average American takes in about 3,500 milligrams of sodium a day. We only need 500. We take 7 times more in. That damages the blood vessels, raises them. So that was not a bad early treatment. Then they said, well, let me cut the nerves that cause adrenaline. That's called a sympathectomy. That wasn't such a good idea or a practical idea. We can't be cutting nerves on everyone that comes up with high blood pressure. Then they found medicines like sodium thiocyanate, reserpine, all these ways to lower blood pressure. Then one called hydralazine was introduced. Now, we still use hydralazine today to lower blood pressure. We found out that hydralazine was a medicine that was used to treat malaria, but it also lowered blood pressure. So the early treatments really focused on the number and not so much the cause. Then came the one that sort of focused on the cause a little bit more, called chlorothiazide. That's a medicine that takes salt out of the body. So we talked about less sodium, but some people couldn't do that, so they took pills to pull sodium out of the body. When they pulled sodium out of the body, guess what? The blood pressure went down. And we still use diuretics to this day to pull sodium out of the body. But today's treatment, Today's treatment, and this is according to the NIH, the American Heart Association, the American College of Cardiology, on the CDs. Here's where we start once we identify what the cause, why we have blood pressure. Here's the treatment till we can figure out what's causing it. And I'll talk about what's causing it in just a minute, because there's many things that can cause high blood pressure. One, the main treatment was lifestyle. So people begin to think that most of the causes of high blood pressure, the hidden disease, might be lifestyle. It might be too much sodium. It might be too much stress. It might be too much weight. It might be lack of exercise. It might be lack of sleep. Anything that puts stress on the body could raise the blood pressure. So the number one treatment that's recommended by all of these societies first is lifestyle treatment. But guess what? We don't see lifestyle treatment as the cornerstone for treatment too often. It's just not, people just don't want it. You got to go a visit to a doctor. You have 5 or 10 minutes, and what's he going to do? First of all, sometimes he's not even sure you have it, but he's going to say, here, take a medication. Take a medication. Sometimes he doesn't start with lifestyle. But lifestyle is a very appropriate place to start, especially if people have lifestyle changes that might lower blood pressure, and especially if they do not have organ damage. Now, if you're having organ damage, you need to bring it down right away. So number 2, medicines. But that wasn't the place to reach. Now, sometimes I use medicines, but until I know my patient. I talk to my patient and say, listen, how would you like to lower your blood pressure? I look at all of the causes and I give them a plan. Would you like to lower it with lifestyle? But unfortunately, many people say, no, I don't really want to do that. I would rather take a pill, receive a bill for my ills, and I'd rather have the expense of a medication and the side effects of a medication. Well, I think that's okay, but I think free will is very important. So I let them do that because I still want to help them lower their blood pressure so they don't have damage to the organs over time. But that's not the primary recommendations of all of these societies. So let's talk about lifestyle. But before we do that, I want to spend a second talking about many of the causes of high blood pressure are related to lifestyle, but there are medical conditions, many of them are related to lifestyle, that drives up the blood pressure. Sleep apnea, thyroid disease, problems with the adrenal glands, a few things that are sort of genetically, one's called coarctation of the aorta. We can have problems with the renal arteries sometimes. We can have different types of tumors that make aldosterone or pheochromocytoma. That can make blood pressure go up. But we call those causes are relatively rare, but we still look for them. So a part of a good hypertension evaluation is first making sure you have it, 2, evaluating the causes, and then doing a detailed lifestyle history to see if there are things in your life that you could do to lower blood pressure if you choose to do that. So some of the lifestyle changes that can be made. Avoid stress in general. Well, why does that help? Well, when you're under stress, if I scare you like that, guess what? Your adrenaline goes up. So everyone out there, probably a blood pressure surge for a second. 1 or 2 seconds, not a big deal. But if it stayed up there 24 hours a day and you were scared and making adrenaline and cortisol, your blood pressure would be up all the time. Then we'd see this damage. Avoid stimulants. I had some person the other day that didn't realize that things like Red Bull, he was drinking 3 and 4 Red Bulls a day, and that was making his blood pressure go up. Cocaine, that's a stimulant that can make your blood pressure go up. Amphetamines can make it go up. Other substances like nicotine, alcohol, all those things. Too much sodium, so you want to decrease the sodium. Too much fat, exercise, all of those things are things that can do to help lower the blood pressure. That's a lifestyle changes. Now, there are some foods we can eat that lower blood pressure as well. But think about some of the foods we need to avoid. We need to avoid things that are processed. Sodium, not good, raises blood pressure. Fatty foods, we need to get away from that as well. But different foods, greens, great way to lower blood pressure. I like to recommend arugula. It has a lot of nitrates. It makes nitric oxide, which makes the blood vessels bigger. Flax has been shown. Now, many of the vegetables lower, but these are the ones that have been proven. Hibiscus, that is sort of something that helps quite a bit. Watermelon, kiwi, grains. But any time a person has high blood pressure, they really want to bring it down. It's things in their lifestyle. We encourage people to go on a whole food, plant-based diet, drink lots of water, try not to eat big at night. I think intermittent fasting, a small meal at night, also is very useful via the circadian rhythms, via the rest, cutting back some of the cortisol levels. So these are some things to do. And then, so lifestyle focuses on most of the causes of blood pressure, but there is a place for medications. So let's say lifestyle doesn't bring it down. Let's say we have a person that comes to the office. And unfortunately, I practice medicine every day, and many people don't want to make lifestyle changes. So if they're going to not want to make the lifestyle changes, if they don't want to lose weight, if they don't want to eat differently, if they don't want to remove the stress, that would be a place for medications, because I still want to bring down the blood pressure that can cause this end organ damage. Now, there's some people that have genetic conditions. Sometimes hypertension runs in families. Sometimes we get stiff arteries as we get older, and we do have that. So some genetics have high blood pressure, and we do everything we can naturally to bring it down. The number's still high. Then that would be a place for medications as long as they don't cause us side effects and as long as they don't affect belief systems. And then we've already touched on the many medical conditions that would require attention, and sometimes we'd use medications until that problem could be addressed. For instance, I had a person the other day that had hyperaldosteronism. So their adrenal glands were making a lot of aldosterone. That was what was making their blood pressure go up. It was high, 240 over 140. So we gave them medications to bring that down. We didn't want a stroke. We didn't want an aneurysm. We didn't want a heart attack. We brought them that down until we could take care of the problem, which was an adrenal adenoma. That was removed surgically. Their blood pressure came down, and we were able to wean off those medications. Some people that get treated for sleep apnea, their blood pressure goes lower because they make less epinephrine, less cortisol, which raises the blood pressure. Some people have an overactive thyroid, and we can cut that down. So they have certain medical conditions that we can treat and not need medications for long periods of time. So there is a place for medications. So the JNC8 guidelines, that came from the Journal of the American Medical Association. They have as their recommendations a plethora of medications. And physicians choose the medications based on what they think would work the best, what they think was triggering this, but there's lots of medicines. They focused a lot on medicines, but recognize that lifestyle changes are the place to start, especially if people are having problems with medications. If people can bring it down themselves, that is always the best way to go. So I just want to stop here. And here's some contact information, because hypertension is a very complex subject. But I just wanted to give you the basics today as you listen. First, I want to encourage everyone to have your blood pressure checked. Have it checked correctly. After you are off stimulants, you sit down, breathe deeply for 10 or 15 minutes with a cuff that's large. Check it 3 or 4 times and see what it's running. If it's consistently high, I would go see my provider, and the provider will evaluate you for the end organ damage that we talked about. And it might be looking in the eyes, doing a neurological exam, might be checking an EKG, it might be looking in your urine, it might be more advanced testing. But for sure, they'll talk about your genetics. Then if you indeed have high blood pressure, if there's no end organ damage, they can talk to you about the options to bring it down. Maybe there's some lifestyle changes you can deal with. Maybe you need some medicines for a short period of time. Maybe there's an underlying cause of your high blood pressure. I can't tell you how many people now have sleep apnea as a cause of their high blood pressure. But as we saw earlier, 1 in 5 people will have this. Many don't even know they have it, and yet you don't have a symptom until something bad happens. And that's why we're having this seminar. That's why it's called Hypertension, the Hidden Killer. Because it can be killing you, and you don't even know you have it. You don't want to find out that you have hypertension when you have an aneurysm in your head that burst, or you have an artery that has a heart attack, or if you have a heart and go into heart failure. So to speak, the cat's out of the barn when that happens. So we don't want that to happen to any of you. And I'll tell you, the world is under so much stress, mental stress, anxiety, people not sleeping at night. And I'm just wondering, as we go on, the stress of having information overload. Can you imagine? It used to be years ago, we didn't have cell phones. We didn't have all this data all around us. But all of that data input, it has to cause some stress, and in vulnerable genetics, it might also raise the blood pressure to go high. So these are all things to think about as we contemplate hypertension, the hidden killer. But remember, we in modern medicine, we name diseases based on medical conditions. You know, we saw that with diabetes. And as you saw with hypertension, it's taken years to describe this condition. Years and years. And yet, how we treat it, how we manage it, continue to change. But I want to encourage each one of you today to get at the cause. Think about it. You are your Christ is your best physician. There's some text in the Bibles. In all ways acknowledge me, and he will direct your path. If any of you lack knowledge in James, let him ask of God. But seek ye first the kingdom of heaven, and all these things, including your health and what to do about it, will be added to you. So if you're having high blood pressure, start with Christ. Because even if you have the worst medical condition in the world, God can use that condition to glorify himself. Paul was an example of that. He was never perfect. He wanted to be healed, but he carried around affliction because through that, he brought glory to God. And I don't want anyone out there to be sick with high blood pressure, but if there's things that we can do about it today, think about it. That might be a good place for you to encourage your relationship. So I want to stop there and spend just a few minutes answering some questions. Okay? Are we ready to answer some questions? I'm talking to my directors here on the floor, and it looks like it's a go, right? Okay. So let's answer some questions. Now, I can't go into all of these because some of these might be a whole nother lecture, especially about the pandemic and spike protein. That's a whole nother lecture, a whole nother webinar for another time. But this is from Herb, and it has to do with the spike protein. What is your recommendations of the COVID vaccine if the introduction of spike protein illegally increases blood pressure? Well, Herb, I don't know all of the details of your life, but as right now, I cannot really, as a physician, it's according to what your risk factors are. But most people, I would not recommend at this point get a messenger RNA vaccine for COVID. That's most people. That doesn't apply to all people. So talk to your doctor about that because it does bring the spike protein in your body, and that is another entire lecture. What do we do with the spike protein that's either caused by COVID or the vaccination? What's the risk and benefit of all of this? But as the pandemic has gone on, I can't really recommend that. Question from Cynthia. Can the slides be made available for download? The answer to that question is yes. Okay? They can be amazing for download if our team can figure out how to do that. And I'm sure they can do that. Also, if you use some of those slides, you will have to have permission from some of the people that made those pictures, which I did. So if you show them in public, you might have some copyright problems. Another one is how much hibiscus tea a day? Well, I try not to worry about exact amounts, but if you want to bring down your blood pressure, instead of drinking what you normally drink 1 or 2 cups of hibiscus tea a day. That will help lower your blood pressure. But remember, there's phytochemicals in hibiscus tea. There's also phytochemicals in many other herbal teas that will also lower blood pressure. I use hibiscus tea particularly because hibiscus tea has been studied and there's numerous literature about hibiscus tea. But I think it helps not only the phytochemicals have things that lower blood pressure, but I also think that sometimes tea just helps relax the body. So you make less adrenaline, less cortisol. It helps relax you. So I would try to do 1 or 2 cups if you have high blood pressure. See if that works for you. And remember, some interventions work on people and others don't. So I tell people, try one thing at a time. See if it works for you. If it works for you, stick with it. The one that works the most consistently is eating greens 3 times a day with some flax. That seems to work well. Walking works well. Avoiding sodium works well. Going to bed earlier at night always seems to lower it to some degree. So those are some things that you might help. Okay, Rochelle has a question here. She says, I would like to know how alcohol use affects hypertension and how it contributes to stroke. So hypertension raises blood vessel damage, especially the endothelium. It makes the arteries weak, more prone to store fat, and that in and of itself increases the risk of stroke. Now, we also know that alcohol in itself raises blood pressure. So we know that alcohol raises blood pressure. We know that blood pressure can raise the risk of stroke. So if you really want to lower those risks, you're going to probably want to cut back on the hypertension. Would you recommend taking magnesium to reduce high blood pressure? Well, that was from Mi Ling, and it's according, Mi Ling. A lot of people that eat plant-based diet get plenty of magnesium every day. Now, if you don't eat a balanced diet, yes, you need magnesium. So you can take magnesium in many different supplements, but most people that eat 3 to 5 fresh fruits and vegetables a day get plenty of magnesium. There's about 8 or 9 magnesium supplements out there. I recently came up with a video on that, and if you go to Biblical Prescriptions for Life on YouTube and look up magnesium, I go through all of the different magnesium supplements out there, the risk and benefits. But most people that eat a balanced diet do not need magnesium. Magnesium oxide is probably the easiest absorbed, but there's many other different magnesium supplements that people use for different situations. Paula says, my blood pressure is fine, but my cholesterol is 230. Can I try lifestyle changes by eating oatmeal for breakfast every day and help lower it? Well, Paula, that's sort of off our topic today. You can certainly try that. But your cholesterol, your total is 230, but it's very important for us to know the bad cholesterol, the good cholesterol, and also the other aspects of your diet and lifestyle before that question could be answered. Yes, you can try that by eating oatmeal for breakfast every day. It might help, but you might have to also see whether it's predominantly good cholesterol, predominantly bad cholesterol, and we'd also want to know about the rest of your diet as well as your exercise program. Now, a question from Cynthia. Does hydrotherapy help with hypertension? Well, we have a few studies done that when people have hydrotherapy, it dilates blood vessels. So it can temporarily bring blood pressure down. I don't think hydrotherapy would hurt. I think it's worth a try to see if it would work for you. And it might help it depending on what type of high blood pressure you have. If you have high blood pressure that's generated from a medical condition, hydrotherapy might not help with that. If you have hydrotherapy that might be generated from stiff blood vessels, it might help with that because it helps dilate blood vessels, the heat itself. So the studies haven't been done in the scientific literature that says, yes, if you do hydrotherapy 3 times a day, it will help, but I don't think it hurts with blood pressure problems. Now, hydrotherapy, if you're on medications, your blood pressure can drop too low as well. A question from Geralda. Can hibiscus tea affect your kidneys? If your kidney function is normal, usually not. So you might want to check with your doctor, but hibiscus tea in general, if you have normal kidney function, does not usually affect your kidneys. So there's many different ways to approach blood pressure. And remember, our individual genetics and the cause of hypertension are important to factor into all of these equations because there's no single path that's perfect for everybody. So a lot of it's trial and error based on your belief system, especially what you might have available. I have some people that live in food deserts where they don't have options to good food. I have some people they can't exercise as much, they're in wheelchairs, or they have chronic illnesses they can't do as much as well. Okay. Is Celtic salt and or Himalayan pink salt okay for someone who has hypertension or high blood pressure? Well, remember, all of the salts are made of sodium chloride. So sodium chloride, it's according to the total amount of sodium in your body. Some of us are more sensitive to sodium than other people. I have some people that can salt their foods and eat processed food and their blood pressure is still 120/70. But some people genetically are salt sensitive. So Celtic salt, Himalayan pink salt, yes, they're probably great salts, but you still might, even on that, take in too much sodium. But if usually you keep less than 500 milligrams of total sodium a day, you're usually in pretty good shape. In fact, the American College of Cardiology, they're recommending about 2,000 milligrams, but I refer people to elephants. Elephants don't have high blood pressure. They're some of the healthiest animals in the world. They eat lots of greens, they walk a lot, they get vitamin D, they drink lots of water. They usually stay away from high hypertension. So that is a great question. But again, a lot of this is according to the overall picture a person might have, a detailed lifestyle history, which would include sleep, hydration, mental stress, anxiety, the different types of food we're putting in. So I try not to just focus on an isolated ingredient. We have to sort of put everything in a picture as well. So turmeric, the question is turmeric helpful in lowering blood pressure, and does it interact with blood pressure medications? Turmeric in itself, I found, is great for inflammation, but doesn't work well for blood pressure. And yes, turmeric can interact with certain blood pressure medications. Here's the problem that I found. Most of the blood pressure medications that are out there, even though it can interact, it is not really described in the literature because they haven't studied all these blood pressure medicines with the different herbal ingredients that are out there. Like many blood pressure medicines can interact with other things in our body as well. So a lot of it has to do with trial and error. If you're taking turmeric in a blood pressure medicine and see your blood pressure change dramatically, that would be something logically I would not do. But in general, turmeric, I haven't seen lower blood pressure. It helps with inflammation, but certain medications it can interact with, but it's not been well described. So we have about a few minutes left here on our discussion, but I want to go over some highlights, some bullet points, and if you have some more questions, I'd like to answer them. So a couple bullet points is, first of all, since we've entitled this Hypertension, the Hidden Killer. So if you're sitting there, first of all, I want to ask you, remember we said 50% of cases are undiagnosed. Do you have undiagnosed hypertension? Do you even know what your blood pressure is? So the first thing, usually when I give webinars, the people that need this information are the ones that aren't watching the webinar. So it's going to be dependent on you guys out there to take this information to your friends and neighbors to help them. And you can talk about, listen, do you even know, talk to your friends and neighbors. Have you had your blood pressure checked this year? You know, why don't you go to the drugstore, sit quietly for a few minutes and have it checked just to see if you have high blood pressure. And if it's consistently high, you might be one that has hypertension, and it might be subtly and slowly killing you, as we talked about, all the organ systems. So those of you that have this information, use it as a witnessing point to other people. And that's what I like to do, is I like to have an interesting health topic, and I present something every week at biblicalprescriptionsforlife.com on YouTube. I have a topic there. We talk about a medical issue, but the real issue is not the medical issue. It's pointing people to the real solution to all of our health problems. And that is, the key to health is Christ. And if we focus people to Christ and they start worshiping and spending time with Him, and through the power of the Holy Spirit and the promises of Scriptures, they realize that we need to take care of our bodies. There's some things that we can do to change. Well, you can do this with your knowledge of hypertension. You can go out and encourage your friends and neighbors. You can say, listen, we want to take care. I want to try to help you not have one of these big problems. If we do that, this is helping our fellow neighbors. It might not be as exciting as healing leprosy or making the lame walk, but it's still a way that we can serve, and God can use us as His hands and feet to minister to the world. Question from Mo: what about coffee? Coffee can raise blood pressure. If you're drinking coffee, raise your blood pressure. If you drink energy, raise your blood pressure, and see if it's raising your blood pressure. But, there's so many individual items that can raise blood pressure. You almost have to change lifestyle changes one at a time. I can't tell you how many people have sleep problems also. Excuse me, I'm going to sneeze. That lower blood pressure. Okay? I have people that receive words or use unkind words or have anger or strife at work that raise blood pressure. We have people that drink too much coffee that raise blood pressure. I see a lot of guys that drink Red Bull that raise blood pressure. I saw a couple people in the hospital that did amphetamines that raises their blood pressure. So when you talk about blood pressure, it's a detailed lifestyle history, realizing that it's a problem and actually just getting it measured correctly. I had a patient the other day that got their blood pressure medicine and they were scared, and they were 85 years old. And she was scared in the office, and she measured her blood pressure. It was like 210 over 120. And the doctor panicked. And he said, "Here, take this medication." And they took that medication, and really their blood pressure was high because they were under temporary stress. We call that situational hypertension. We worry about high blood pressure if it's up all day long. If it goes up and down in regarding to a stressful situation, we don't worry about it. But this poor little old lady got a medication. She went home. Her real blood pressure was 130 over 60 when she was relaxed. She took this medicine. It made her blood pressure go too low. She got out of a chair, got dizzy-headed, fell down, and broke her hip. She came to the emergency room. Her blood pressure was 80 over 60. She had what we call orthostatic hypotension. In the office, it was called situational hypertension. So you really want to make sure the diagnosis is correct before you start any type of treatment. Now, the lifestyle treatments never hurt anything. They're all pretty good about that. Hawthorn berries. The question came about, what about hawthorn berries? Hawthorn has been used as a heart treatment for years. It's been shown to actually help the strength of the heart, and it can help some arrhythmias of the heart. And in some people, not many, but I've seen it lower the blood pressure a little bit. But it doesn't help lower the blood pressure, I would say, as much as walking 1 hour a day. It would not be something that I would reach for in my group of patients because most of mine cannot buy hawthorn berries. They just can't get to them. But it might, in some people, lower it a little bit. There hasn't been studies on hawthorn berries like we've seen on the greens, which make nitrates, and some of the others, flax, some of the other things. We don't have the literature as involved, but I've seen it work on a few isolated people, especially if they don't have interactions with others, and especially if they have access to the real hawthorn berries. Okay, so I'm going to sort of wrap up our session here. We just have a couple minutes to go, and I want to encourage everybody to get their blood pressure checked, go to a provider. Make sure you don't have end organ damage. If you don't have end organ damage, look at all of the lifestyle factors out there that might be bringing down it. Treat the lifestyle factors no matter what it is. And then slowly, one but surely, try to add things into your life that might be bringing the blood pressure down. And if after that you still have high blood pressure, see your provider. And if your belief system is agreeable, start trying a medication, because I still say when everything else fails, it's still better to have a lower blood pressure on a medication than a higher blood pressure, especially if you're not having side effects. Now, I prescribe many blood pressure medicines through the years. There's many ones out there, and every medication has a side effect. So when I prescribe a medication, no matter it be a beta blocker, a calcium channel blocker, or a diuretic, I always monitor for side effects. And if there's a side effect, I say that medicine needs to go away. So I want to encourage you, if you want to learn more, go to my website, heartwiseministries.org. You can check me out on YouTube, Biblical Prescriptions for Life. My website is Heartwise. My email is heartwisejm@yahoo.com. If you want some dramatic lifestyle changes, check out Wildwood Health Institute. They have a lot of great programs. So let's end our session today in prayer. Father God, as we have spent a few minutes thinking about hypertension, the diagnosis, the treatment, the history even, we know that you're a God that's in control, and we want our thoughts not to be only on us and on this earth and on our medical conditions, but we want our thoughts to be with you. We want to spend time in worship, because we know that worship in itself will lower blood pressure. We know that worship will save us for eternity. Worship will give us hope. Worship will give us insight. And through your Son, we will have eternal life, because the key to health is Christ. And we thank you. And we want to thank and praise you this day for everything you've done. And for all of those that are listening out there, I want to pray for their health, blessings, and help what they've learned today. They can go out and share it with their friends and neighbors so that that might bring them to a loving relationship with you. This is our humble prayer. Amen.